Hi, my name's Ian Wright, and I want to talk to you today I just want to explore a couple of topics around osteopathy and temporomandibular joint or temporomandibular dysfunction disorders, jaw problems, osteopathy in its relationship with dental and orthodontic practice, and craniofacial pain. It's a hugely wide area, has a lot of detail in it, so I'm going to kind of keep it quite simplistic. I've been lecturing this stuff for probably over 20 years. And actually, I started work a long time ago, it must have been 25 years ago. I started doing some consultancy practice work with a very far-thinking, advanced, really, dentist called Tom Heesum, and God bless him, he's dead now, God rest him, but he was seeing a lot of complex cases of craniofacial pain and was looking at ways to ameliorate that, to help it. And I came in and into his practice and started consulting on some of his difficult cases. Actually, in the end, I ended up working at the practice, and we ran this craniofacial pain clinic for about 8 years, actually, which was fascinating, and because I gained loads of experience in working in that field. So that was in Surrey in England. Anyway, let's just talk about a few of the areas that are important and that are related. We're just going to start actually with the development of the face in utero. So when a baby is developing, it's fully developed by the fetus is fully developed by about 7 weeks old, and the jaw joint, the temporomandibular joint, actually starts to form at about 10 weeks. But from about 7-8 weeks old, tiny embryo going into a fetus, the mandible can move. So it has this ability to move up and down. So this movement is free in the development from the beginning. It's interesting because the movements of the embryo in terms of its growth and development match the movements that we have as adults. Anyway, that's a huge subject I'll talk about another time. But babies, when they're born, have a very small face. Their maxilla, which is the upper kind of jaw, upper part of the mouth, and the maxilla, which is the lower part, are very small and very tight. And actually what happens is these bones develop and grow a lot between, say, 7-8 years old. So the face really, that's when sort of a child, a toddler, suddenly turns into a boy or a girl, really, because you can see that face developing. And it's very important for a lot of areas, including ear drainage, but also it's to do with the development of the second set of teeth. And the mandible develops an awful lot. So patterns in adult jaw dysfunction can start very early on, actually. A lot of babies that we treat, the mandible, the jawbone, is often depressed backwards and compressed in the birth process because the head and the neck get tucked in, and there's a lot of compression, even in a normal birthing delivery, and that bone can get locked up very importantly from day one. So we're often releasing these immediately. Now, if you have that kind of compression, that can affect the development of the jaw and the development of the dental arches. Also, there's a huge amount of tongue tie that is being diagnosed and treated in babies now, an increased amount. And the possible reasons why I'll go into on another podcast, because it's a huge subject in itself, and we spend a lot of time working around with tongue tie and tongue tie release support. But tongue tie can affect the development of the arches of the jaw, because if the tongue is locked down into the mouth, the jaw can't open fully correctly, and all of the neck muscles at the front of the neck get tight, and everything gets kind of quite squashed in there, and everything doesn't lengthen out correctly. But as we grow and develop, these dental arches develop, and the occlusion, which is how the teeth come together, is formed. Now, often it doesn't form correctly, and the mechanics of the top and bottom jaw and how they come together are very controlled and governed by the mechanics of the cranial bones. The bone, it's called the cranial base, which is actually up and behind the eyes. Because imbalances further back in the bone, in the skull, actually affect the way the two parts of the jaw come together. And there's all sorts of different shears and dysfunctional patterns which we're trained to diagnose, which predispose to malocclusions. And we can eradicate, again, another really important reason for treating babies, them from day one and allow the formation of a good occlusion. So a class 1 occlusion is when the back teeth and the front teeth meet perfectly. It's the perfect smile. Not very often do people have it. A lot of people have class 2 malocclusions where the maxilla or the top teeth are actually come out in front when you bite the back teeth together, the bottom ones. And that's called a class 2 malocclusion. There's different divisions of that. And that's very common, and it's been linked often to things like Western diet, sugar, etc., etc. But it's also got a strong genetic component to it. A class 3 malocclusion is when the bottom jaw is jutting out in front of the upper, where you're really sticking that jaw out, and that is very strongly connected to the mechanics of head and neck and the cranial bone mechanics, and it's very important to treat it. I'll spend a lot of time treating it. But actually the first thing that we treat with regards to jaws and teeth is babies who are teething incredibly painful. Some babies' teeth horrendously. My eldest daughter was a horrendous teether, no matter what you could do. So actually just allowing a little bit of relief in these areas where everything locks up, and it locks the ears up, and it locks the top of the neck up, and all the membranes of the head lock up, and they're very, very irritable. A lot of babies actually, if their cranial bones are all very locked up, actually the teeth find it very hard to come down. So you've got to free up the maxillary bones and the mandibular bones to allow the teeth to come up and come down. Very important. Again, when the secondary teeth come in, that's very, very important. Then you've got all sorts of dental dynamics. So we're looking at these development of these arches and how these arches of the face and the jaw and this occlusion starts to form in terms of the teeth positioning. And then there's all this huge field of orthodontics where I spend a lot of time working with supporting orthodontics because, orthodontics varies, and it's actually changed a lot, thankfully, very recently, where more of a sort of orthopedic version of orthodontics is starting to actually come through. And 20 years ago it was incredibly hard to get, which is more to do with development of the arches and not taking out the fours and pulling everything backwards, which locks up the face. So actually nowadays orthodontics is more about opening the arches, which is very good for the I'm interested very much in the cranial bones, which are behind there, and I'm also interested in headaches and craniofacial pain. So orthodontics, there's often a lot. My son, who's just gone through 3 years of beautiful orthodontic work, but every time they'd be tightened up, he'd start getting headaches, which is incredibly common. So I spend a lot of my time the day after or the same day as people get their braces tightened, releasing all the membranes around it just to allow them to accommodate it. Also, when you release the cranial bones which are behind it, it helps the speed of the change in the transition in orthodontics. So very important area, and spend a lot of time working with dentists with that. Just an important little thing that we look at in our field is the relationship between the jaw and the top of the neck and with the pelvis. So these are it's almost like a triangle of function. And if one part of one is dysfunctional, it can affect the other. For example, if you've got a twisted and locked up pelvic function, it can actually have an effect on the position of the jaw, and the jaw can be out of place. And equally with the position of the head or neck. So when we're looking at function, we have to look at those three and the balance and harmony of those three elements. Anyway, I just want to talk just a little bit about TMD, temporomandibular dysfunction, which is a huge area. A lot of people have this problem, a lot of people. And it manifests often as pain in the jaw joint, which is sort of below and in front of the ear, or it can give you headaches to the side of the head, or frontal headaches, or neck pain, etc., etc. So also a clicking jaw, difficulty opening the jaw. When you open your mouth, it pulls off into a certain direction. Actually, if you open and close your mouth, very often it drags off a little bit in the sort of mid-phase to the left or right. That shows a sort of muscle imbalance in the jaw joint. And if you think about it, our jaw joint has to undergo a huge amount of stress. The power involved in some of the muscles of mastication, the muscles of chewing, is huge, and the forces of the teeth. So this jaw joint has a huge amount of force applied through it, and if it's dysfunctional or out of balance, it can quickly become a problem. So the jaw has two phases of open. Well, there's sort of three parts of it, but two main parts of it is it unlocks itself, so it translates forwards and backwards, and then it rotates open and closed. So you've got this kind of complex balance and interplay of ligaments. There's a joint capsule. There's a disc that's involved. Well, actually, which has three parts, which can become dysfunctional in different ways, and a complex group of muscles which work together in harmony and sort of antagonistically. One tightens while one releases to allow for this complex maneuver, actually. And when we're chewing, we don't just have up and down, we have side to side, back to front. There's a lot of complex movement. And also, of course, what I'm doing right now, we're talking. Talking involves a lot of jaw function. Now, as I've said earlier, all of these development of these arches and problems with the cranium and other areas of the body can manifest in dysfunction of the jaw. So the jaw can be out of balance. And when it's out of balance, it tends to tighten up. The muscles tighten up. And what happens at night, actually, what happens is we close our jaw, we tighten our jaw at night when we're sleeping, and when we swallow, we lock the back teeth together, and we swallow a lot of times in the night. And every time we do this, it locks up the teeth more. And people grind or brux their teeth at night, sometimes in the day even, which actually can quickly wear out not just your teeth, but actually the capsule and the disc of the actual jaw joint. And that can cause a lot of problems and can become very, very, very painful. And we spend a lot of time working with this. It's very important just to work out, actually, and we spend a lot of time doing this, working out if someone has craniofacial pain or headaches, work out where is it coming from. Is it coming from the jaw? Is it a migraine pattern? Is it some sort of trigeminal neuralgia or various other headache syndromes that you can have? So actually trying to work out where it all comes from. And often it's not just one thing. There's layers. There can be a headache pattern, a migraine pattern, a TMJ pattern, all interrelating. And so there's different types of headache patterns that overlap each other. We're often having to unravel those stories, very complex. Also, just one word about stress and emotions. When we're tense, we tighten our jaw up. And some of us walk around with very tight jaws all the time, especially at night. If we don't release and relax at night, we'll go to sleep with a tight jaw, and it will really, our teeth will be dragging on each other and tightening up all night. And this causes a lot of dysfunction. You can wake up with headaches, etc., etc. So when we're looking at these problems, we have to look at the functional balance of the mechanics of the neck, the throat, all the muscles of the actual mastication, actually the muscles of moving the jaw, the balance of the pelvis, the head on the neck, and the jaw all together, all the cranial mechanics which govern actually the positioning of the jaw, and kind of unravel this story and bring it into balance and help with this clicking, locked, whatever jaw situations that can happen. So it's a wide area, and it's very interesting and quite complicated, but it's a good area as osteopaths where we can really get our teeth stuck into and really unravel some of these stories, and it can help a lot of other areas. So actually, we treat jaw and problems from a brand new baby, 2 to 3 years old, and we who's having difficulty feeding, for example, to someone who it has temporomandibular problems when they're getting a lot older. So it's a wide area, and I'm really just skimming the surface. Anyway, I wish you well.